Neonatal nursing works with newborn infants born with a variety of problems ranging from prematurity, infection, birth defects, cardiac malformations, and surgical problems. There are approximately 255,500 high-risk neonates that are born each year in the United States. In addition, as with all nursing careers, the demand for neonatal nurses and neonatal nurse practitioners is expected to increase drastically over the next 10 years. However, there is also an expected shortage of these nurses in the near future. This is because approximately 1/4 of all NNP education programs had closed over the past several years. This has left many registered nurses unqualified to provide specialized care to newborns. To be qualified for this job, extensive schooling and training is required.
Steps to becoming a neonatal nurse include completing your undergraduate education, becoming licensed by the state, doing clinical training, and completing the certification. After this, you can pursue further education if you want to. Here you can see the student is working really hard and studying in order to pass her NCLEX exam. First, you need to become a registered nurse with the BSN and pass the NCLEX to receive a state license. Nurse training, where you gain most of the experience, comes next, and depending on the location, you must complete a certain number of hours of clinical experience in a hospital setting. You can also complete certification through the ANCC or NCC to demonstrate expertise in your specialty. From here, it is optional to advance in your education by earning a master's to become a neonatal nurse practitioner and not only higher your earning potential but also expand your skills and knowledge.
Level 1 in neonatal nursing is also known as the wellborn nursery. This level is a minimum required for any facility that provides maternity care. Here you can see that the nurse is evaluating the baby by taking its measurements such as height and weight. The nurse then places a small and comfortable tag on the baby. This tag is used for the baby's protection. This eliminates misidentification and unwanted consequences. The nurses usually care for full-term and healthy infants aged 35 weeks to full term. The neonatal nurse must be able to perform neonatal resuscitation, evaluate newborn infants, provide postnatal care, and stabilize ill newborn infants until they are transferred to a higher level. Level 2 is known as the special care nursery. Infants who are in this level are temporarily ill but are expected to recover soon. These infants in Level 2 may also be recovering from serious illnesses treated in Level 3.
These nurses provide specialized care such as administering oxygen, intravenous therapy, and overall they provide constant attention to the sick babies in need.
The role of a neonatal nurse working in Level 3 and 4 works in the intensive care unit part of the hospital. Level 3 and 4 takes care of all the neonates for the first 28 days of life who can't be treated in the other levels. These babies are premature, underweight, or sick infants who require high technology care, which include ventilators or incubators. These nurses in Level 3 and 4 are able to provide continuous life support and comprehensive care until the baby's conditions improve and then could be transferred to a lower level facility.
Being a neonatal nurse means performing many easy and difficult assignments. A lot of training is required within the neonatal department. Working with newborns can often be difficult because they require a considerable level of care and attention. Since they are still in the process of getting themselves used in the outside world, getting their condition monitored continuously and having their paid attention to the baby is very important because it helps determine if the baby is in a good and healthy state. Because of the efforts of neonatal nurses, there is a higher chance of survival for premature babies. This is why the job of a professional in neonatal nursing is very important because it has changed the lives of many babies and their families.